Good morning, everyone. I'm Mike Blake, and welcome to Midday with Mike for this Thursday, January 31st, 2013. Hope this chilly end of the month of January is going your way. It is great to have you with us. Got a lot of interesting people for you to meet. Beginning in just a moment, nurse practitioner LaDonna Pfettscher from Digestive Care Center will take your calls. Mike Ball helps us preview an important milestone for the March of Dimes. Chris Tyner and Keith Blazer talk about Civic Theater's production of 3 Days of Rain. Psychologist Jeff Stuckey joins us. He's from Stuckey Counseling. That will be in Connect with Mike. And lastly, ophthalmologist Andrew Tharp will help you with your eye problems. He's from Vision Eye Care. That will be in the next half hour. But right now, have a question about hepatitis. Our Ask the Expert guests can certainly answer that and other related questions. LaDonna Pfettscher can be reached at 433-3456, 1-800-959-1414. As we await your calls, nice to welcome LaDonna to Midday. Good to see you. There's a name change here. What did Digestive Care Center used to be?
We used to be called Gastroenterology Associates. There's been a lot of rumors as to why we changed that name, but the bottom line is we did some marketing research and we found that the general population, number one, had a difficult time pronouncing the word gastroenterology.
Broadcasters included.
Okay, and number two, they also weren't quite clear as to what disease processes we would treat in our office.
One of the diseases, of course, that you treat, LaDonna, is hepatitis, but that's a wide topic, isn't it? Explain.
It is. The term hepatitis simply means inflammation of the liver. The whole goal of our practice is to determine what is causing that inflammation, and that can be a multitude of things. It can be fatty liver, it can be alcohol, autoimmune, or viruses. Can
the environment, our location, can it play a role in causing hepatitis?
Not typically, other than the fact that we tend to overeat in our local area, and again, that falls back onto the fatty liver.
And of course, that must be the case throughout the country too.
It really is.
Our society
unfortunately
is too heavy. Talk about what are the two primary types of hepatitis?
I can't really say that there are two primary types. I will say that probably, again, fatty liver is one of the leading causes, and I would say hepatitis C falls close behind.
Let's go to the phones. Our first caller, Becky in Owensboro. Becky, good morning. Please go ahead.
What is hepatitis B and how it affects the body?
Well, hepatitis B is a viral illness, and it primarily will impact the liver. And the biggest concern that we have with any type of viral hepatitis is the fact that it tends to be somewhat insidious. It doesn't cause a lot of symptoms, so a lot of people can be infected with hepatitis and not really know that. And as the years roll by, it slowly does damage to the liver and ultimately can result in cirrhosis.
Becky, thank you very much. Is there a certain age when hepatitis becomes prevalent? Do young people ever contract it?
Absolutely. And again, it depends on if we're focusing on viral hepatitis, it depends on certain activities. Hepatitis B tends to be transferred more sexually versus hepatitis C tends to be more blood to blood.
Let's do one more call before the break. Ann in Stendal, Indiana. Ann, please go ahead. Ann? Go ahead. Hey, we're going to take a brief break. Maybe we can reconnect with Ann. Again, please give us a call. These are the numbers. The lines are open. 433-3456, 1-800-959-1414. Ask the Experts back in just a moment.